Good morning, everyone. I'm so delighted to be here at this wellness industry conference. And as wellness industry professionals, I know you are all invested and very passionate about providing services, products, and resources that support our patients and clients' sense of well being. Many of you work in the multi-billion-dollar weight loss industry. You may have seen the topic of this talk, weight loss, and opted to attend this talk, hoping I could provide you with just one more useless technique for weight loss to sell to your constituency. I'm going to disappoint you. We are here today to talk about non-weight loss, about how the science overwhelmingly shows that healthy, sustained weight loss isn't even really possible. While this cultural, medical, and scientific shift is helping to alleviate unquantifiable suffering, it's likely not going to be great news for your current revenue streams. But if you can be brave, if you can be open, if you can stay in your seats, stick with me and decide for yourselves. I'm Linda Holland, PhD and faculty member for the Department of Nutrition and Food Sciences at the University of Arkansas. This curriculum is sponsored by the following three organizations as indicated in the logo at the bottom of your screen: the Association for Size, Diversity, and Health, the Society for Nutrition Education and Behavior, and NAFA, the National Association to Advance Fat Acceptance. Today we'll be talking about an approach to health and wellness that may be very different from what you've heard in the media, sold yourselves, or understood from previous educational activities. The topic of body weight can be a sensitive topic for many. Today we'll start very small with a look at the basics. Guys, the general public is very confused, and I might say we, as the wellness industry, are quite confused as well when it comes to the intersection of weight and health. As this cartoon shows, when individuals focus on losing weight, it can create a psychological problem, a head game. Let's take a closer look at that. Health at every size, HAES, is about taking the focus off of weight. When we do this, we end that head game that is so common for those who diet. This non-diet paradigm is about focusing on health instead of weight. Throughout this presentation, I'll be talking about health at every size by using the acronym HAES. H-A-E-S, HAES. Both HAES and health at every size, you should know, are trademarked terms. They were trademarked by the Association for Size, Diversity, and Health, which is an organization that promotes taking a non-diet approach to wellness. And why? Because dieting doesn't work. The HAES paradigm is about paying attention to hunger and fullness cues. These cues will guide us in eating instead of counting calories or fat grams. That, coupled with finding pleasure in food and satisfying cravings, and trusting that your body will naturally crave a variety of foods, are the hallmarks of the HAES approach. The HAES paradigm is also about movement, being active, but not to lose weight, not because it's what we're supposed to do, to have the right body shape or weight or type, but because it feels good, and has many positive health benefits. With HAES, we're taking the focus off weight, off the number. The HAES paradigm, involves promoting positive body image, seeing weight and body shape, sizes as another key component of diversity, just like body height, skin color, hair color, what kind of eyes you have. Today we'll be exploring HAES. We'll be exploring the research that supports the HAES approach, that says that HAES might actually be one of the best approaches out there for promoting wellness. But before we get into the nitty-gritty, we need to start with the basics. First, we'll define terms such as health and terms such as overweight and obesity. These are terms that we in the wellness industry use on a daily basis. But have we ever taken the time to stop and think about what they actually mean? Then we'll take a look at changes in body weight in the United States over the last several decades. Is there an obesity epidemic? Maybe not. We'll also take a look at the research today to explore the relationship, or maybe lack thereof, between weight and health. We'll talk about various dieting or weight loss interventions that are out there and the effects of those interventions on health. Guys, what we will discover as we look at the data is that diets don't work, which is why we've all been so good at selling them. However, health at every size does seem to be a promising alternative, scientifically a promising alternative to dieting. We're going to look at the research. We're also going to talk about the term weight neutral as a term that describes taking the focus off of weight and shifting it back to where it should be, on health. Today, we'll finish up by debunking some common misconceptions of HAES itself, the health at every size approach. Stay with me. I know that this is a countercultural message. It can be confusing. And today, we're really only going to be able to scratch the surface of the evidence that actually supports HAES. This is an overview. This is an introduction. It's meant to raise questions that we will hopefully be able to answer over the course of our time together. All right, definitions. Let's look at messages about health in the media. When we look at this messaging, the focus is always, when we're talking about health, the focus is inevitably on weight. The overarching message, and I know if you take a minute to really think about it, you'll realize the validity of what I'm saying. The overarching message is always, if you're thin, you're healthy. And if you're fat, you're not. Maybe we try to nuance it, but that is the message that the majority of the general public receives. We also see a lot of information out there about nutrition and exercise. The message there is if you eat better, you'll be healthier. If you exercise more, you'll live forever. The truth is, there's a lot more to health than the reductionist perspective that weight or that health is just weight and nutrition and exercise. let's look at some of those other components. There are so many components to health and well-being that are not diet and exercise. That is a fraction of what determines our overall sense of health and well-being. Let's start with a concrete example. So let's say one day you decide you're going to do the paleo diet. So you begin exercising and you're eating what we in the wellness industry might refer to as nutrient-dense foods. So you're doing this, right? But in doing this, you might be feeling quite stressed out trying to follow these new rules in your life. You might feel deprived, and you end up really just obsessing over the foods that you can and cannot eat. In social situations, you may not be able to participate fully due to these harsh restrictions. Is that really healthy? Doesn't that have an influence on overall health? Given that emotional health is also an important aspect of health, your emotional health may be severely compromised when we end up as a society putting too much focus on very narrow areas of health, such as diet or exercise. Maintaining health involves balancing each of these aspects in a personal and individualized manner. So I'm saying, guys, there is no one size fits all, both in bodies and in the ways that we approach health. We love as a wellness industry to talk about, we're not promoting diets. These are lifestyle changes. There are limits to lifestyle changes on health. Let's say we buy into that and we actually make changes to our quote unquote lifestyle. An individual could have the perfect diet and exercise patterns, but still get diagnosed with breast cancer. So yes, fine, diet and exercise have an impact on health. All the other areas that you see on the slide are important. But overall health has a lot to do with genetics, with access to health care, and with social equality or lack thereof. BMI. So this will be the last area we want to explore before we take our break. We've defined health, or we've at least opened the conversation around it. Let's look at how weight is defined. What does it mean to be overweight or obese? Overweight, obesity are categories used to label weight relative to height. This is the famous body mass index, BMI, that's used to categorize individuals into one of four primary categories. Underweight, normal weight, overweight, or obesity. There are really enormous limitations when it comes to using BMI to assess an individual's state of well-being. BMI, in fact, was never meant to be applied at the individual level. It was developed nearly a century ago to study the trends in one specific population, overall trends. In fact, the person who defined BMI noted that it should not be used to apply it should not be used at the individual level, and certainly was never meant to be an indicator of individual health. What are the limitations of using BMI to assess health? So many. First of all, it doesn't take into account muscle versus fat mass. It doesn't take into account level of fitness. It doesn't take into account differences in muscle mass between genders. Besides the fact that there are so many other determinants to well-being and health besides weight. BMI, as I said, was never meant to even be part of the health discussion. But certainly as it was brought in and used as a tool at the beginning, it was meant to be only a screening tool and not a diagnostic tool, which it is frequently being used as a diagnostic tool. And one of the questions we will need to talk about in our time together is whether BMI is a legitimate indicator of health. In other words, guys, let's think about it. Can you actually, if we're honest with ourselves, can you really tell by looking at someone's height and weight whether that person is healthy? All right. I think that's appropriate food for thought ahead of our coffee break. So we'll wrap it up there. Thank you for sticking with me, and hopefully I've been provocative enough to get you to come back into the room with me after the break.